is Stuart Porter. I'm a family practice doctor. Been in practice for more years than I can count. I graduated from medical school in 1988. Currently, the practice that we have is one that has a couple of family practice doctors, myself and one other. We have a nurse practitioner that's been with us for about a year, and we have a naturopathic physician here in our office. We have more of an integrative medicine type of office here. Well, initially I had some concerns, some of those being, would it interrupt with patient flow? Would insurances pay? And if they didn't, what would that mean to my own patients? What would their out-of-pocket be, deductibles and so on? And another concern I had was, was it going to be a hassle to the practice? Was it going to be worth the effort trying to integrate this in? How valuable was the tool itself? And the other concern I had was, if it does pay well, would that eventually mean that insurance companies wouldn't want to pay because it was working too well? It was pretty much seamless, and we didn't run into any problems that I can think of at all. That went very, very smoothly in all aspects. So far, this has been a real positive in many ways. Financially, it's been very helpful for the practice. I think it's a fantastic diagnostic tool, one that can oftentimes detect problems much earlier than we would find them otherwise with other types of testing. I found it to be an incredible educational tool for my patients because most of these risk factors that we're assessing can be modified with appropriate lifestyle changes. And so it's been a great tool, as I mentioned, for the patients, and it's been a nice bonus as far as the added income to the practice. Workflow really hasn't been affected adversely at all. It's very, very easy and seamless. Typically, after a visit, if we determine between myself and the patient then that this is something that we would like to do, then it's as easy as walking the patient over to a different room where we have the RM3A apparatus set up. So really hasn't been disruptive to patient flow in the least. So with my interactions with our office manager / biller, we really haven't had any problems that I've heard of as far as difficulty with pre-authorizations, difficulty with payments. There have been a few insurances, although rare, that have come back and said that they don't cover that benefit, but that's definitely been the exception. So as I mentioned, it's been a great teaching tool, a great educational tool for the patients, and I think the patients see the benefit once we've gone over the results and explain what interventions we can make to improve those risk factors. It's been very, very well accepted. So there's probably a couple of very significant advantages that doctors ought to look at and consider. First and foremost, it can be very beneficial to the bottom line. Bringing in additional income is always a good thing for practices. It's seamless, it's simple, and it's just a no-brainer. There's no reason not to take a real strong look at it in my mind. Our first payment actually came 5 days after it was billed, so the turnaround was very, very, very quick. In the first 4 weeks that we were using the RM3A, it brought in an additional $11,000 in that 4-week period. So overall, it's been very, very easy as far as the implementation of the RM3A goes. I can't think of any hurdles that were difficult for us at all. It's been smooth, easy. It's improved the bottom line, and more importantly, it's been a great educational tool as far as helping our patients see the need for significant lifestyle modification, to address those risks that are showing up on the analysis. So overall, bottom line here is that physicians should take a hard look at this, and they're rather crazy if they don't. It's been simple, it's been smooth. As I mentioned before, it's really helped our bottom line, and there's just no reason not to take a real hard look at it.